So basically now I'll pass you on to Vesna and she will go through slide 7 in terms of what's happening next and tell us a little bit about also the ecosystem in Serbia.
Mhm.
And then she'll talk to us about the location of the venue as well. And it's kind of a special place, it's brand new. So over to you, Vesna.
Okay, so when it comes to the event in Belgrade, it should be one of these steps that Kevin already shown. So the pitch for the global scope of the Serendipity Collective. Basically, in Belgrade, we have a newly forming structure around biotechnology and bioeconomy. One of the things is the mentioned Bio4 campus in Serbia, which is a novel research and innovation infrastructure, both in facilities and in different ways of creating and managing research. And it's a 450 million euros investment, so one of the biggest in the region for sure. And it should be a focal point for different let's say bio sectors. One is biotechnology, bioinformatics, biodiversity, and the fourth one is um,
Uh,
bioeconomy.
yes.
So they want to connect different researchers, so more than 1,000 PhDs from 7 institutions in Serbia to work under one roof to develop novel solutions. And this is ongoing process in the sense that the facilities are starting to be built, and we expect first one to be finished by the end of 2026. On the other hand, I'm contributing to let's say, scaling up the knowledge about how the research can be managed and funded as a part of something that in the EU is called research manager. So we're doing different types of things. And I thought it is very great that serendipity ideas and way of work can be included in this let's say in this novel way of doing science in Serbia. And the second thing is that the Serbia is very closely connected to the World Economic Forum Center for Bioeconomy. Also, World Economic Forum has a different structure of centers for, let's say, excellence, which are in different topics. And the one in Serbia is related to genomics, health, different uh, applications of AI in health. So, as a Center for Fourth Industrial Revolution, which is the title of each of these centers, Serbia is the only one dealing with this topic. There is currently 12 of these centers around the world tackling different challenges. So basically, also there is a voice that we can create in the World Economic Forum based on this possibilities. So Igor and myself had the chance to contribute to currently one of the reports that are official reports of the World Economic Forum for bioeconomy on the scaling up and accelerating, especially in the health tech. So I think all of this was very interesting scenery and interesting activities that we can contribute then with the serendipity way of thinking. And by the patronage of World Economic Forum, there is this big conference called Biotech Forum in Serbia. So it's a global conference, really in that sense, global, not even regional or European, but the global conference that is taking place for 2 days in the end of October. So it will take place on the 27th and 28th. So we are thinking to have a day before the work with the, let's
So
say, the
it's 2
workshop.
days.
And
It's gone back to 2 days, Vesna, because they were just thinking about one day before.
yeah, so
Okay.
basically the second day would be dedicated to the Nature magazine, so the Nature publishing. And the second day will be dedicated to researchers who want
Oh,
to publish at Nature. They want to give them different types of understanding of the way the nature functions and different types of both articles, data sets, open kind of research, pre-publications, so the preprints, and also patents in the realm of nature publishing. So it's not only for the journal itself, something that is more visible that when we think about nature, but also other things. So the second day would be a little bit more closed to selected researchers, but I think yeah. So it's the other day for the forum, and we will have the pre-day in which we will have the workshop and work with our guests in Belgrade. And maybe on the next slide,
Yep.
what is interesting.
Just on the Biofuel Forum, so
Mhm.
we all attended the Biofuel Forum last October, and we were very well welcomed already. But the Serendipity Collective was very well received, actually. A lot of people came up to us afterwards and said, how great it was and wanted to learn more about it as well. So I think Belgrade or Serbia will be a great home for the Serendipity Collective.
Great.
As well.
Yeah. So what is also interesting about the forum, it's not only for exchanging the opinions and networking, but it also has this point in which the government tries to invite different venture capitalists, so mostly from the US, some of them from Europe, but they're related to Serbia either by Serbian descent or having some connections with Serbia. And that is why they want to put a little bit more effort in communicating with our community and share the knowledge and see how they can invest. So I think that is also interesting for other participants because they can have like a very straightforward connection with them and speak with them, and it's a very, I think, great opportunity to meet these founders. One of them, which might be prominent in your community, would be Swiss Rockets. They're now huge company also in the pharmaceutical market. So basically the founders are personally there at the event, and you can speak with them and interact, which is great. And about the venue is also novel. It's part of the strategy of Serbia to be more in the creative industries. So this space has the aim to connect different people from very different backgrounds to create something new. So it's not only for creative industry in the sense of art and visuals, but also connecting with the science. The space is model with different kind of venues that can be used, but also it will showcase some of the current artworks and visuals from Serbia. So I think we will enjoy it quite a lot. And it's in the new part of Belgrade, which looks like a little bit like Dubai, maybe from that perspective. So something very creative and important that connects people, but in the very novel part of business side of Belgrade. So I think we will really enjoy being there.
Great. Thanks, Vesna. So we will give you guys updates in terms of the place and the activities that we're planning. We should do something new as well. I think we've tried Berlin, and then we tried the similar stuff in Estonia, but hopefully with Vesna and her creativity, maybe we'll come up with something cooler even this time.
Yeah.
All right.
So basically there are two venues. You can see them in the picture. One is this round building, and most probably we will be situated there. But on your left side, there is this glass building, and the glass building is actually designed to be hanging from a different pillars. So also architecturally, it's very interesting, and I would like to, organize a tour of this other building, so the glass building, so we can see a different approach to building and to architecture and use of space. So that would, I think, be interesting for people with the different ideas to see one very different idea being implemented.
Thanks, Vesna.
Thank you.
Really looking forward to it. Okay, so let's get to the meat of it now. So basically, let's get updates from each of the teams. So let's follow this agenda. So NeoVivum first. Maybe Scott, you can tell us a little bit about Green G, then BMI, and then eventually our latest startup called Daystrom Labs, which Marina will tell us a little bit about. So over to you, Igor.
Yeah, thanks. Just a second to to share my screen. Okay, so I will give you a brief outline of things that were happening in the last year and a half. But before that, I just want to test your way of thinking. So the question you do not need to answer to, just I would like you to think about it is, what exactly do you think you're seeing here and in the next few slides? So this is the first slide, the second one.
If you've got ideas, either call it out or put it in the chat.
Yeah, okay. Third and the last. So I guess now it's quite obvious that it's a sample of 6 rectangles. I guess at some point during this succession you clicked, probably on the previous slide, most probably not on the first one. And what you actually was seeing is a succession of rectangles with added different percentage of deviations. And probably your way of conceptualizing things will be different if I reversed the order, but I wanted to start from the most difficult ones. And so that's exactly the question we are dealing in the company, trying to develop a cognitive engine that will be able to conceptualize environments. So not only to recognize patterns, but to try to understand them. Understanding is quite elusive and loosely defined term, so I will not enter into precise definition right now. In the company, we developed a huge list of requirements to be able to claim something like that. But today, I just want to focus on 2 things that are our focus in last months in developing the engine. So the first consequence of conceptualizing something is that it basically functions as a one-shot or few-shot learning. So you see something, you immediately get a basic idea of that, and then gradually through experience, you're able to expand that vision or to apply it to that concept or apply it to different domains. So that's the first one. You do not need very extensive training set in order to be able to recognize something. And the second one is that when you're conceptualizing something, it usually entails hierarchical knowledge organization. So basically, in our mind, we are storing quite simple concepts, use them to build more complex ones, and so on. So that's the process we are trying to recreate in silico in our engine to be able to do exactly those things. And I will show you extremely simple experiment, actually, results of the experiment. Why so simple? Well, in order to explain and understand what is happening, you need to try to avoid as much as complexity as possible. And here we wanted to see what is happening inside of the engine. So we basically started with just three labeled examples. As you can see, there is a horizontal line, one angle, and one randomly created rectangle. And then show them as a kind of labeled them and show them to our engine as a kind of pre-training with three data points. And then we performed experiments where we created 1,000 randomly generated rectangles with, as you saw, sample at the beginning, 0, 5, 10, 20, and 40% deviations. And it's quite important to emphasize that here we do not have predefined goal, we do not have any reward function, and there is no reinforced learning. So what we wanted to implement is just a spontaneous sorting of information by our engine. And as you can see here, blue line is something that is immediately recognized as a rectangle. And when we have 0% deviations, it is quite obvious that the engine, everything everything is sorted properly out based on just one simple initial examples, no matter size, position, or anything else related to that shape. When we started adding deviations, of course, we moved from one shot to few shot recognition, but still it is quite efficient in recognizing things. When the situation became more fuzzy, the engine basically said, okay, that's a rectangle, but it is also composed of different lines and angles. So that's the red line that is basically showing here. And there is a lot of other experimental results, but it would take much more time. So I will just conclude with this part that what we showed and what we wanted to demonstrate that the process of conceptualization, we called it building a concept of rectangularishness. It's a nice short word, easily to remember. So it is happening on the fly, and it does not require any extensive pre-training. Right now we are experimenting on no pre-training at all. The development of more robust concepts is very rapid, even, as I said at the beginning, without any selective pressure. It will be interesting to contrast several agents at the same time to see what will happen, but that's not what we are focused on right now, but soon probably will. And with increased fuzziness of the external world, our analysis of the internal brain, let's call it, is complexity of it increases, but very, very slightly. So this is development and playing with our basic idea, but at the same time, we are also trying to see how these basic things can be applied somewhere else, even without having a fully developed engine, which will probably not happen soon. So what we were also doing in the last year or so is to build a diverse consortia, mostly research consortia, around this core idea and its main aspects. One of them is Cancer Scan. That's a EU-funded project that should start in probably a couple of weeks. Actually, either in 2 weeks or a month from now. The goal is to develop a slide scanner for pathology for diagnosis of patient-specific treatment recommendations. And at the bottom, I put what were the driving force behind it. So learning complex patterns. We are focused in our engine on fundamentals of those, and here is a great playground to see what to try to use this engine to learn very complex and very diverse patterns in heterogeneous tumor structures and different tumor types. And also, since complex concepts are built through experience and this process is fully transparent to us, we can use it as a basically tool for explainability of what is happening behind the curtain of machine learning, let's call it like that. Another thing is something that is submitted about 1 hour ago. That's focuses on predicting nanoparticle targeting efficiency in cancer. Just in one sentence, what is the problem? Problem when you are functionalizing nanoparticles and inject them in a body. Blood and plasma are full of different proteins, different chemicals. They immediately get attached to your drug delivery system, and in the first second of injection, it is not anymore what you developed in a lab. And the huge problem is basically trying to account for that problem and predict what will happen. Here, again, from our standpoint, same problem. Extreme complexity of the process and dynamics of protein corona formation. And again, the need for transfer learning for adapting this approach to other non-tested nanoparticle types. That's kind of robustness of conceptualization of environment. So that's also embedded here. And the last one, also submitted today, is a project where we are developing a kind of device and a smart treatment recommending system for magnetically induced tissue regeneration. Basic concept is also quite interesting. If you have magnetic nanoparticles, they can accumulate the outer surface of cell membrane, and if by external magnetic force you move them, they will by that movement also disturb ion channels and sensory proteins, and that will in turn change state of cell, because state of the cell basically depends on external signals. So here is the idea is to fake external signals to trick a cell to faster enter into regenerative physiological state. And again, from our standpoint, the same problem applies here. Complexities of different nanoparticles, different magnetic field configurations, complexities with cell state control that needs to be somehow sorted out to define some kind of biomarkers and apply that outside of the immediately tested samples to different ones. So again, very nice playground for our engine. So to conclude, what we are doing in parallel is developing the core engine, but also trying to apply its main principles very early in a biomedical domain that will. And those experiments will basically help us first to test in the real world what we are thinking about, how the engine should look like, and also it will help us to move faster. So our journey towards evolvable consciousness, which we started with, is branching. But sorry.
It's evolving.
It's evolving, yes, as the main keyword says. So yeah, it's evolving in different direction. North Star is there, but it's not a simple line, but somehow branching and evolving path. So yes, thanks.
Great, Igor. That was great. I mean, what I really loved about your project is not the fact that you're our little local Leo da Vinci as well, in terms of, the ideas that you have, but with those ideas, you've been able to convince a pretty impressive group of people as well in your consortium. So between those three consortiums, I would count that you've probably got around 20 professionals, like, real.
20 groups, more
Yeah, exactly.
professionals.
Yes, 20 groups.
Yeah.
Yeah, you're right, because there's even more professionals in
Yeah,
there.
Each group is several people. Yeah.
Yes, and really well done, Igor. And yeah, we're all proud of you.
Thanks.
Okay, let's move on to the next one. Let's leave Green G. Well, let's do Green G. I think Green G was next on the list. Yeah.
So
Yeah.
Green G's next on the list. So since the team's not here and able to make it, they had some delays, right? They were Serendipity Collective Year 1 winners, but they were unable to pull off the conference last year in October when it was originally scheduled. So they postponed to April of this year. 26th, 27th, something like that. And they had held the event in Lisbon. Neither Kev nor I were able to go, us due to travel restrictions. We're not allowed to travel right now. But I did attend virtually. The meeting was small, but it hosted a rather diverse group of researchers, which was nice. It kind of mimicked the team itself, right? Where Michael Danielle, who came from NC State, has a strong experience in mechanical and electrical engineering and signal process. So there were a number of researchers that worked in that space, but there were also researchers working in the fungal space. So we're talking about electronic and chemical signals that those organisms utilize for their own communication and environmental survivability. So there was a lot of panel discussion. I think there were 4 separate panel discussion events that focused around the mechanical sensing aspect, the environmental signaling and biomarker signaling that these organisms produce. And in each of these panels, they would have an engineer and a scientist, and then someone else random, sometimes someone from policy or funding or the like, to kind of chat about their perspective and where they see the field going. It was an interesting meeting because, of course, Carlos, Christina, and Michael were all Serendipity Collective alumni, so they were coming at it from the perspective of where are we going to be in, well, Michael said 500 years, but let's be honest, none of us are going to make it that far. But 10, 20, 30 years, whereas a lot of the other researchers were very focused on the near term. And so there was a bit of fantasy as well as a bit of reality in all of the panel discussions and the scientific presentations, but overall it was a very interesting meeting. 30 to 50 participants, I would say. I was sad to miss the social events because, as we all know, that's where the great science is discussed. It's in the pub. But overall, a good meeting. Still waiting to get the final report and feedback on that one, which we should see in the next month or so.
Yeah. And we'll share that as soon as we have that as well, as public, right? So,
yeah, for sure.
Thanks, Scott. All right. Next, Yakin and the team.
Thank you. Yes, I'm going to share screen. Here we go. Yeah, well, it's really nice to see everybody. Thanks for the platform and the opportunity to share progress. On our end, we've been moving rather slow on our own time, out of our own pockets, but we've made some pivots and some strategic decisions, and we're now mainly focused on building our own mobile EEG scanner. I would like to just share a couple of highlights, a few milestones in 3 categories: research, BCI, design, and innovation concerning our hardware. On the research front, for the last couple months, we've recorded new batches of EEG hyperscanning data. We're recording 2 people playing music at once. We're looking at interbrain synchronization. We're looking at markers of to optimize group team performance and flow. This is happening at our institution in JVLMA. Also on the research front, our colleagues and us are publishing new findings from this study. We're finding information results that will be able to inform our brain computer music interfaces, our team-based BCIs. We would like to use collective EEG signals to control machines and access data and to cooperate. On the BCI design front, I would like to show you just a few highlights from the last year. This is Martin's vision. It's an art installation. It's a two-person brain-computer interface in an augmented reality art installation performance. This was part of a citywide multimedia art festival. We both had our brains scanned, and it was responsible for this visual on the floor, the dynamics of our interbrain dynamics. Here's another.
Got the Jedi costumes as well. Yeah, didn't I?
Here's another one, a performance that Martin and I worked on together. I had an art residency in a modular synth company. I decided to connect my brain to control the wall of modular synths, and was able to control analog machines, about 4 analog synthesizers and, I don't know, 10 modules using the brain signal for this performance. That was the result of this was a musical instrument called neurosynth. That's what you can see on the screen here behind me. I'm running this musical instrument. We've also been using this technology in education. Here's some clips of us using it in Osaka, in Japan. I was there last month, and we used the BCI to in a group improvisation setting where I changed the color of the lights with my mind, and this signals my bandmates what my expressive intentions are. So I'm kind of giving nonverbal communication to my bandmates while I'm playing. Just last month also, I incorporated the BCI into an orchestral performance. Here I'm controlling the sound of one of these big orchestral drums with my mind, together with a local chamber orchestra. So these are different BCI design software that we've built. However, we've been really realizing that while we've written a lot of software, we rely on other people's hardware all the time, and other people's hardware is limited. It's not designed for our envisioned applications, and so that's why we've been focusing on trying to build our own hardware so that we could use all of this cool software that we've built and make it available to people. On the innovation side, last time we met in Tallinn, Martin synchronized his brain signals with mine, with Kent's across between Tallinn and Riga. This was a demonstration that we could measure and synchronize brain signals or harness multiple brain signals remotely from a remote location as well. You could synchronize and get metrics on a team working together, whether they're together or apart. For the assembly of our first EEG prototype, this is what we've been working on mainly over the last couple months. Martin has been sending his different breakthroughs of assembling this board, getting it to work bit by bit, testing each pin, making sure that things are working. Our idea is so that once we have the components assembled, then we will move to designing a prototype to miniaturize it and to patent it. I'd like to give Martin, if Martin is still here.
Yeah, thank you, Jürgen. I just realized that you put the screenshot in the previous slide from the WhatsApp.
Yes.
Okay. Yeah, at the moment we are focusing to build a EEG device that could be capable of reading around 16,000 frames per second. This means we can capture brain thoughts in a microstates that they're called like microstates, where you can capture the path of the thought. That means we can build AI algorithms, and we can really track down what's happening on the skull. As well, we can reduce the frame rate. As you can see on the left top corner, we can reduce the frame rate down to, for example, 500 hertz, and then we will cover 256 channels on the head, which is insane. For example, right now, the device we are using, they are able to capture only 500 frames, or some of the other devices only 250 frames. So as well, we are focusing on the hyperscanning. So we would like to use multiple persons at the same time. And for that reason, we choose at least 3 devices to connect to the one base station. So we can see here that there is 3 devices that connects to the base station, and the base station communicates to the computer. And as well, as you can see, these connections are fiber optic. It's because of you cannot connect any kind of cable to the head. So in a case there is power issues or something, so we are eliminating this one by the optical cable. So as well, we do not want to use a Wi-Fi or Bluetooth communication. So that's why we are going to optical, because at the end we are losing just 2 or 3 samples till the computer, which is tiny a bit. And as well, we have a GPS unit, which is somewhere around the corner in a building, placed by the window or outside, that can reach our base station up to 1 kilometer. So we have a special communication that could be actually happening very far away. From that moment, we can connect and do a local analysis of the 3 devices, or we can join, as Jakin showed previously, we can join through the cloud, and we can join labs all over the world, or maybe beyond. Yeah, basically, that's the thing right now. And right now, I have successfully built the first that you can see, that signal amplifier itself. Now it's quite large, but actually, yes, it's doing the 16,000 frames per second and working very well. Thank you.
Thanks, Matt. I mean, Yakin said that you guys have been working slowly, but I think you've been pretty prolific in the last year, to be honest. And it's this great attitude that you guys have as well. Whenever there's a barrier in front of you, you will just grind down and work through it and come up with another play. So honestly, that's what it takes to be successful. And I think you guys have got all the elements in that, honestly. It's wonderful what you've done so far. I mean, let's see how we can take that the next step. Maybe we can talk to Scott about, just getting you guys a little bit of funding. Like you said, it's been out of your own pockets for now, but I think you've proven enough around what you have done in order for us to find some more funding that you need, so that you guys can actually concentrate on it. It's not funding just for the sake of funding. It's actually money so that Martins and Yakin can actually concentrate on this. And
let's schedule a meeting for the next week or so.
Yeah. Well done, guys. Thank you.
Thank you.
Thank you. Thank you. Well, thank you all very much.
Hey, we've kind of run out a little of time, but there's still Marina, who's been dying to tell us what she's been doing since Estonia. So please, if you can stay, that would be great as well. So without further ado, I'll hand you over to Marina, and she'll talk us through what she's been up to.
Okay, so again, I'm not sure if you heard it, but these previous 2 presentations are difficult to follow up, but I'll try. Okay, so first, I'm really excited to share idea and progress. I'm really looking forward to any feedback you have after. So I want to start with sharing this idea because I truly believe that this is something that can change healthcare as we know it and why it matters for all of us. And that is development of human digital twins from now on. So digital twins have the potential to transform medicine from reactive, so when we go to doctors just after we get sick, to proactive, and from generalized to personalized. And with this technology, we can see how drugs and diseases affect multiple systems. We can track individual disease progression and design truly personalized treatment. And we can also accelerate drug development and start creating much, much better drugs. Now, this is pretty ambitious idea, so it required very expert interdisciplinary team to start to tackle it. I will shortly go through all of us. So I'm Marina, and I'm the project leader. I have a diverse background, as you can see on the slide. And my main job was to develop this theoretical framework and protocols for multi-scale biological modeling integration. We have Dr. Ana Jakovljevic, who is MD. She provided crucial clinical expertise. And Dr. Skurbalija, Savic, and Radakovic, they were working on practical implementation of these principles, all contributing from their different relevant expertises. So this is the fundamental problem that we are addressing. So today we have really fragmented view of healthcare. Basically, we are making critical life decision using isolated information. The most simple example can be, for example, if cardiologist gives you medicine, they cannot know exactly how that affects your kidneys. And the fact is that both drugs and diseases affect multiple systems at the same time. We do have some models which are specialized to predict some things for specific organs, but none of them can capture complex interactions that emerge from multi-systems. And the core issue is that although we have these great specialized models, they were not designed in such a way that they can someday work together or communicate. So our vision basically is to create a unifying framework to connect these isolated biological models and to pave the foundation for the true digital humans. And this framework will work across all scales. So it will work vertically, connecting cellular scale, tissue scale, organ scale, whole organism scale, but also across different systems. And what that simply means is that this way we can understand how some phenomena on a cellular scale affect how our entire organism respond to certain stimuli. So why hasn't this been done before? Well, the answer to that is actually quite simple. We wished for digital humans for a very long time, and we built extremely well and extremely good specialized models. However, only now we have exponential growth in biological data. We have advanced modeling and machine learning techniques. We have increasing computational power, which is necessary to support this. And we actually have experimental capacity to focus on the personalized medicine. So at this time, we have all the building blocks, but what is missing is the structure to connect them all. And that is the gap that we are addressing. So when I came to the Serendipity Collective, all I had was idea on a small piece of paper, and I think we progressed quite a long way from that, both on theoretical and practical side. So what the major steps were in this previous period. So first of all, we, as a first step, we really took inspiration for previous work, multi-scale tumor digital twins, which actually Igor mentioned before. And the issue with today's models is that you create medical digital twin for a specific use case. It gives you specific information, and it's really difficult to adapt it for something else. So our first step was to analyze our previous work, extract generalizable principles to outline methodology, use that to draft blueprint for the entire framework, and then apply these principles as a proof of concept to validate that the essential part of this framework actually works. So before we could actually start building anything, we needed to answer a very fundamental question. And that question is, what exactly is human digital twin? Today, we have various definitions. There is no universal one, and they span from AI models, which really fail to capture biological complexity and cannot give insight into underlying mechanisms, to other definitions, which are massive, rigid models that are practically impossible to build. So we really wanted to change our approach and to first define what human digital twin should be in the future, and then define something that can have actionable steps, but also a definition that will not be obsolete 30 or 50 years from now. And what we came up with is the human digital twin is not a fixed end state. So it's not a model. It is a framework that captures essential characteristics. Adaptive architecture, integration capabilities, dynamic representation, interoperability, scalability, knowledge integration, and so on. So in the next step, once we knew what it should be, we really had to think about, okay, but how can we design such architecture and have those characteristics? And the inspiration for that basically came from Lego bricks, because if you ever built Lego, you know that you have all of these different blocks. You can mix and match them, but they all fit together. So to transfer this into our framework, basically we want to have modular structure, but their dynamic processes are separated. They're connected through central data structure. And what that means is that as technology advances, both experimental and computational, there will be no need to restructure, rebuild. We can simply add new modules, add new bricks, and evolve them further. Crucial thing in this framework, apart from this, is communication between scales and communication between these different modules. And the most elegant solution to that is you take Internet protocol approach. So basically, the way that Internet protocols connects different networks, that is what we want to do. We want to create protocols that will connect different biological models. So different models can work together and we can save the best of them. So keep what they do best. So for practical implementation and our proof of concept, we decided to use our general principles in our protocol to simulate something completely different than the tumor. And we chose liver lobulus. And that was pretty strategic for multiple reasons. So first, liver lobulus is functional unit of a liver and represents most of the structures necessary for bilirubin detoxification process. But also, since our future goal is to connect multiple organs, not just multiple vertical scales, kidney is the next logical step because liver and kidney share this bilirubin process. Anyway, so I will go shortly through this because this is quite technical, but what we've done here is we created a model of liver lobulus, which contains central vein, which is not shown here just for the clarity, also the sinusoids. It includes hepatocytes, it includes oxygen and bilirubin transport. The portal triads are at the end, at the corners. And the red color, which is slowly fading, is bilirubin transporting by being uptaken by the hepatocytes. Important thing that we also included here is liver zonation, because hepatocytes in different zonation have different enzyme expression levels, which means that that affects how much bilirubin they can uptake. And that was quite important for the process. So in the next step, what we want to do is now we have liver lobulus model, and that model is detailed and does certain things. However, we want to add more scales. So at this point, we characterized individual cells, defined biological rules, see how they work together, and what we can observe on a tissue scale. But in the next steps, we want to add additional scales and additional computational approaches that can give us different types of information. So what we will do is take this model, use the virtual slices, run different simulations on different slices to get different type of information, and then feed it back in the main model. And what we are doing, we are creating a closed feedback loop where one scale informs the other. That represents actually the multi-scale nature of our physiology. Now, what I think is important to mention here is that both the liver and liver-kidney integration, that is just demonstration of the framework. So that is just one use case. Once this framework has been validated, we can use this framework to model any other organ or any other systems of organs and get different type of insights information from that. So during our time with Serendipity, we completed the first two phases. So first, idea refinement, method development, theoretical work, practical implementation with liver lobulus. For our next steps, and that is something that we are seeking funding for, is okay. So first, we want to increase the fidelity of our liver lobulus model. For now, it was simplified just to prove and demonstrate that essential components of this framework work, but we want to include more details. Then in the next phase, we want to use exactly the same framework to model completely different organ. And then finally, something that will be a critical milestone, that is to connect these two organs together and see how, to see emergent properties for those two interacting together. And finally, after that, we will expand to other organ systems, not only organ systems, but also nervous system, lymphatic system, and so on. So finally, we can have full-scale protocol framework documentation. And now this phase 7 is just the finished product, but of course, we will going to keep developing the protocol framework throughout this throughout these next phases and continue to improve and continue to validate it with practical implementation. So that's a short overview and short summary. So first of all, thank you for the attention. And yeah, I welcome any questions and any feedback you have for me.
Fantastic, Marina.
Yeah, thank you.
When we look at the three different presentations and even Green G, there's been a lot of pivoting. And in BMI's case, it's kind of pivoting back to the core of what they wanted to do, and that's really cool. But even in terms of your project as well, you were kind of struggling with what you wanted, and it looks very different now to what you had it in Estonia, in Tallinn. So really, I mean, it's been great, and now I can see you've got a direction, you've got that North Star, and now you're going for it. So wonderful to see. Just before, do you want to tell us a little bit about the company name and how you came up with that? You're on mute, I think. Maybe take out your earphones if you've got those connected.
No, can you?
Hello? Oh,
Oh, there you go.
Yeah.
okay. Do you hear me now?
Yes.
Yes.
I don't know what happened. So yeah, I'm pretty proud of that name, to be honest. So I'm a huge Star Trek nerd, and Star Trek has been inspiration for me my entire life, both personally and professionally. So when I was thinking about the name, Daystrom Institute is the most famous science institute in Star Trek universe, especially in our galaxy, and it's really famous for cutting edge research. And I felt it was quite fitting because, okay, so I, in general, want to, get us closer to Star Trek future, but also I want to get us closer to Star Trek medicine. Because in Star Trek, what you have is holodecks, where their doctors tend to run simulations of different treatments and diseases so they can treat their patients more effectively. So I just feel like all around there's just a perfect encapsulation of something that I really want to do. And thank you for letting me explain that.
Thanks, Marina.
Thank you.
Just wanted to have a general feedback session, and maybe we can go through to Pravita, Matthew, and you, Scott, in terms of what you've seen so far and what the future would hold. So maybe, I don't know.
Could I speak? Because I have to go, so
Yes,
if I'm going to
absolutely,
speak now
Matthew.
would be a time. They are really great projects. They have come on a lot. I think it's really interesting to see the interplay of so when we discussed like the approval of the mind control synth to see like artistic cultures and to see how they're part of the innovation, as well as the incredibly rigorous but fascinating work that Igor's doing, which feels like of a different tradition. Again, your very theoretical scientific tradition, but equally fascinating. So I think the interplay of those different cultures is really productive and is probably quite unique to the collective. I think what I was thinking also was that if I was continuing involvement would be I was actually thinking around design fiction, around some of the ideas as they've developed. At the moment, we've been sort of front loading the creativity as a way of launching out the collaboration of the event. But it seems to me the ideas have got quite evolved to the point where you could create science fiction or design fiction within them or using them as a pretext. And that might be quite a fun thing. I'm going to be working with my students again in the autumn. Might be quite a fun thing to do with them. Yeah, so lots of thoughts. I mean, all of one-shot learning is something that I've already, I did a lot of work thinking about in terms of creativity around the human imagination and its role in that. And there's a lot of fictional work in there. I've written stories did my debut novels about digital twins and the interaction, the potential to have real-time interaction between yourself and your digital twin is quite fun. I think there's quite a lot that can be done there. So yeah, I'm very positive about it, but I do have to go because I've got some other people on the Zoom call. So if there's any follow-up with me particularly, do let me know. But it'd be great to see everyone again.
Well, if you're around for some noodles later, once you finish with Zoom, I'll ping you. I'll ping you anyway because I'm around today and then I'm flying out tonight.
I'm in Essex and I'm running a university department today. I've got no noodles for you today. But
thanks for the feedback, Matthew, and really looking forward to the design fiction thought as well. See ya.
Yeah, bye.
Prabita, you still there?
Yes, I am. I'm actually handling other calls, apparently. I am. But you can see and hear me because
Yes.
I have two calls. Okay, great. I know that I had a leap of disconnectivity. There's lots going on. But I said, let me peep in to see what progress has been done. I think I did see Igor's project at the evaluation phase, if I remember correctly. Yeah. But what impressed me is this unique combination where I do not see in the other pictures that I think that's something art, creativity, fiction, design, and science, without forgetting the science. That's very important. I think that was a very good combination today. And the digital twin, I'm just wondering, I need to go back and see what was the original written stuff just to see how the idea evolved. Because I don't remember exactly, but I remember having evaluated it and giving my comments. So even with BCI, I have used BCI during my career into health, and this is the first time I'm seeing it very well translated. Because this is what we always tell our people, we need to pivot when we have something proven in one field, move it to another idea, another field where we can generate more and combine the things. So I would be interested to know because for the BCI team, there's music, there's BCI, there are neurodegenerative diseases. And we all know that, topics like freezing of gait has to do with music. Music is the only thing that you can unfreeze a freezing of gait. And they need BCI. So can you go in this direction for future? If at all you get a chance, finish this. That would be something to look at it. And Igor, for me, it's classical. He's very traditional. I find the way he's approached his own project. And kudos to you. We also need people who are from the real, the classical scientific way. And yes, since I've worked in nanotechnology and this whole biotechnology, I do understand. And I hope that even there we can bring in more creativity, if that's possible. If that is a mandate, what the Serendipity Collective wants to go, I would look at it. But overall, I'm literally, awe of what has happened because I was away and I came back and I said, oh, they have progressed and it's real progress that we could see today. So I'm happy. And kudos to both of you, Scott and Kevin, for doing this I think that's you're doing some good job, because I've been fighting. I've been working on the TRLs in the last, and I'm like, oh, TRL 3 to TRL 6, TRL 7, and then I said, oh, he's covering TRL 1 and 2. It was like perfect for me to go and tell somewhere else. So that's very important, and maybe be very careful that when you finish off, that you have quantitative measures, just not qualitative, because that's a big we're having everywhere.
Thank you. That's good advice as well. I'll try and catch up with you over the next couple of weeks, and also with Igor and the team, just to explain a little bit more in terms of what they're doing. But it's nice to have you kind of pop in and see the difference as well.
Yes.
Because when we're in it, like, each of the team members, they don't feel like they're moving anywhere, but in fact, it's a gigantic leap that they've taken as well. So thank you for your comments and the encouragement that you've given them as well.
Yeah, wonderful. And I have just, I was just sparked because, okay, I joined a bit late by the Belgrade Bio4 and the Serbia thing. It sounds very inspiring for me to be there. I'll try to make my best, because it's a weekend. I could still make it.
Yes,
if
exactly.
I've noted the dates well. It's weekend, sounds like.
Exactly. Yep. So it's the 26th and 27th of October, and that's why we wanted to get in there early to let everyone know as well, especially, the experts and the panel to be there. Yeah. So it'd be great if you could make it, Pravita.
Yeah, definitely. And yes, I think Scott and you both, please reach out to me. There are many things moving around. Things are changing. So talk to you again. And you need me for evaluating something, off the line, you can just reach out. Correct? Okay. Thanks. I need to get back.
All right. See you.
5 minutes for the next call. Bye-bye. Good luck, everybody. And thank you. Have a great time. Keep doing the good work.
Wonderful. All right, Scott, last
word. So it's good to catch up and see what everybody's been doing. So I will say that I have heard from Igor and Marina far more than Joachim and Martins, but really blown away by what everybody's doing. I want to catch back up on some things, right? I know some of you owe me a white paper.
Yes. Looking at you, Marina.
Looking at you, Marina, since you're right in the center of my tile block.
And also Igor owes you a white paper as well after today.
Well, Igor looks like he's really busy. So I will say, Igor, that you never fail to impress. You do a good job with the sales pitch. As far as showing how your technology transfers to something that's a little more tangible and, let's say, marketable. Not that the others aren't, but that's one of the things I'd like to sit down and talk to the BCI team about. Right, you guys have really made some great leaps, and as everybody knows in science, or everybody who has been in science long enough, right, you still do the basic research and focus on what's of interest to you. It's just how you package it to get money. And I'm not sure what, I don't know what your conversations were like with Martina, but I really saw a lot of potential in this project, and I just don't understand why. I mean, granted, the US is a hot mess right now. Right, but there's a lot of potential for enhanced training, right, and education, which I think could be explored, and I kind of want to talk about that with you and the team. It's good to see new hardware being used. Not that the shower cap wasn't super attractive, but I like the new look, gentlemen. It's fantastic. But I want to, when we're not so time constrained, with all three groups, let's set something up and talk about what the best path forward would be. I'm still very optimistic.
Let's not leave it until October.
No. Well, I don't want to do that, but I want to revisit it in the next couple of weeks.
I'll set that up. I'll look in your agenda.
I looked at my calendar. My calendar's a mess next week, but I definitely want to fit it in like a 90-minute meeting with everybody, so we can kind of walk through where you are, what you're doing, and what your vision is, and where we're not rushed. I find that an hour is never enough time for a single meeting, let alone when we're trying to talk about 3 or 4 projects. It just doesn't really work. So I made some notes. I have a lot of questions for you all, but I want to go down and do a deep dive to see, what you're focused on, and what the interest is, and maybe how we can find a path forward. All right. But everybody's doing great work. It's really good to see, how these crazy ideas have just started to materialize and move forward. But I mean, that's the way science works. With a little support, you can start to realize your vision. We just need to find a way to keep it moving. All right. So let's think about that in the next couple of weeks. If Kev doesn't get eaten by a great white shark, keep telling him you don't want to swim in Cape Town. He doesn't listen to me. But you guys all have my contact info. And if you see on LinkedIn that Kev was bitten in half by a 7,000-pound shark, reach out to me directly. Okay.
But they can just say, I told you so.
Yeah. To your pieces, to your pieces. Yeah. But
All right, gang.
All
Really
right.
good to see everyone again. And great job.
Definitely great work. And it was good to see everyone.
Bye.
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 Bye, everyone.
Thanks. Till next time.
Yes.